My name is Michael Battelle, and I'm the president and founder of the Fatty Liver Alliance. I am so excited today to speak with Dr. Matt Dukewich, who's a Transplant Hepatology Fellow at the Keck School of Medicine of the University of Southern California. Matt, you recently were lead author on a very important paper entitled, I have to take a deep breath for this one, but Differential Effects of Cardiometabolic Risk Factors on All-Cause Mortality in U.S. Adults with Metabolic Dysfunction-Associated Steatotic Liver Disease. But you identified, and this is the most important part, you identified three of the deadliest risk factors of MASLD. It would be so great if you could tell us why you did this study in the first place, why it's so important today, and what you discovered.
Yeah, thanks for having me, Mike. So, really the core idea behind this research and what I hope to study more in the future is thinking about this kind of new label of MASLD, of metabolic dysfunction, steatotic liver disease, where we really focus on the metabolic dysfunction part. And this labeling has kind of helped us define and characterize the disease better, but it really leaves us with this broad, variable, heterogeneous population where we put a lot of people under this umbrella, but we don't quite know who progresses and who has what outcomes and who's most at risk for the really life-impacting consequences of the disease. So really just kind of putting myself in the shoes of, talking to a patient who either first is diagnosed with MASLD or is referred to specialty care, with a hepatologist and talking about MASLD. And I was really struck at we don't have a good answer to what's next. What are the consequences of this? We kind of know that some people will develop cirrhosis. Some people will develop cirrhosis quicker than others. Some people will have liver-related consequences. But it's really this broad population that we don't have a good job of identifying which risks for bad outcomes are within that really umbrella. And so this study, we wanted to look at, among the metabolic risk factors that are used to define MASLD, which of those are kind of portend worse risk for bad outcomes, for death. And in this study, we looked at, a US representative population through the NHANES study, and we kind of categorized those with MASLD and looked at which risk factors particularly were associated with higher risk for all-cause mortality. So really looking at this broad outcome of any cause of death. And I think the highlight here was that hypertension and diabetes were kind of these risk factors that had the greatest risk for death. And really looking at the study, it was a little bit surprising that hypertension itself was one of these greatest risk factors because when we think about MASLD, we often think about diabetes and the insulin resistance category, but there's not as much focus, at least right now, on the risks of hypertension.
No, and in fact, it's not usually one of the top 4 or 5 risk factors that we use to identify patients at risk of MASLD. But you've looked at this from a whole other perspective because this isn't about the risk of MASLD. This is about the risk of mortality for people who have MASLD. So my first question, of course, then would be for patients that are identified even at a primary care level, and maybe they've done a FIB4, and then maybe they've done a transient elastography or other non-invasive tests, and they found out that their patient has MASLD. Let's say they've identified that even before they've sent them to a hepatologist, and maybe they don't need to send them to a hepatologist because they don't have MASH, but they have MASLD. Is your recommendation, I know it's early and, but I'm going to take a shot here. Is your recommendation then to refer them to a cardiologist? And who else would you refer them to? Do you think, I guess, endocrinologist? Would you send if they're not already seeing those specialties? Yes?
Yeah, yeah. I kind of think of, maybe really kind of three pathways where this research can really help. One of those is, when MASLD is identified and these risk factors, whether it's hypertension or diabetes, are identified, kind of an important thing for either primary care physicians or, these kind of initial healthcare providers to identify are that it's not just the liver disease that's important for our patients. It's these other outcomes that are often driven by these metabolic risk factors that really need to be, at forefront here. And, in addition to the liver-related consequences, we just want to think about what also ends up downstream of hypertension and diabetes. I think number two to take away from this is that there's a lot of focus on making sure that diabetes is well optimized, is treated as aggressively as possible. But I really kind of hope that this study brings to voice the idea that we need to focus on really aggressively treating blood pressure as well and keeping blood pressure under control, really up at the front line when hypertension or high blood pressure is diagnosed, but also when MASLD is diagnosed. And maybe this kind of calls to attention that both for providers and for patients that really taking high blood pressure seriously in this setting is very important. And then I think part three is also you're kind of highlighting that this is a multidisciplinary disease and it really requires the input of endocrinologists and hypertension experts and hepatologists in some cases as well. And utilizing those early referrals for aggressive treatment is something that will have I hope will have a meaningful benefit on, our patients' lives.
Okay, so before we go, I also want you to be really clear with any primary care treaters, so that's physicians, nurse practitioners, et cetera. What message would you give them? They see patients that have metabolic comorbidity overlaps in all of these areas. What would you say to them based on what you learned from this?
I think the really key learning point I have from here and the message I want to take is that really focusing on treating these metabolic comorbidities early and aggressively is important. I think back to previous to my hepatology training and thinking in primary care clinics, and there's it's kind of easy to say these subtle changes in blood pressure or diabetes. It's kind of easy to focus on the more or you would say less effective treatments up front and kind of give time for treatment to really kick in. But the idea is here is that these comorbidities really have meaningful risks in the long term and making sure that these are treated as best we can and kind of finding treatment strategies that work best for patients, whether these are lifestyle modifications, diet and exercise, but also with medication therapy as well. These are kind of the things that really should be part of that initial treatment or initial kind of risk stratification, if you will, for those with MASLD, that making sure that we're treating the blood pressure and the diabetes and all these metabolic comorbidities as completely as we can early on, because it really has a meaningful impact on our patients.
Okay, wise words. Your work is important. I thank you for taking the time today, and I will make sure as many people as possible can see your work. And I'd love to follow up for your next work, whatever you're going to focus on something else as a next step to this, I guess. And you can leave us in suspense, but we'll look forward to that.
Thank you, Mike. This is a pleasure.